I've been trying to look up and collect definitions of scansion, and the quote that you mentioned in your chapter, the Stuart Schneiderman quote, when he talks about what it was like, so I looked it up, and he says this thing about the combined pressure. It creates a situation that greatly enhances one's tendencies to free associate. But he mentioned something about the death of the short session. And I used to think this was kind of sort of Lacanian melodrama, like death of a session, it's not really a death. But one of the things that you really highlight there very well, I think, is the almost radically agentifying or subjectivizing potentiality of some of those techniques. Now, without romanticizing and idealizing them, because that doesn't always feel like, it doesn't always work that way when you're the analysand and the door gets open, and you're halfway through your second paragraph, so to speak. But I think what you're making is a really, really significant point. The phrase you used was have to face their life anew. And one of the things I struggled with, but I think have kind of managed to get a little bit about scansion is, so not just the end of the session, but there can be interruptions, dramatic punctuations in a variety of different contexts. Yeah. But something about the limit point that is thus introduced. And if we want to be, dramatic and Heideggerian about it, the limit point is also the reference to an end, the reference to potentially a final end. And what that enables is not just a kind of historicizing reflexivity of, what now things mean in relationship to this end, but it does, I think, give that impetus, when it works, let's say, of inviting someone to face their life anew. Anyways, I'm not saying anything new that you didn't already say, but it just, the way that you conveyed the point, I thought really helped me think about that. And the reason I want to stress it so much is that presumably one of the most important things that seems to be a common denominator of sorts between a Lacanian clinic and a Fanonian clinic, if we're going to stick with this rather silly, separate thing, which may not necessarily ultimately be justified, is that both of them must speak to agency. The subject's agency, and sometimes a kind of radical agency, which is a bit frightening to confront. And just last comment, the reason all that came to mind was because we've been speaking about the zone of non-being. And I'm not by any means suggesting that all human beings are equally positioned in relationship to such a zone of
right, absolutely not.
Obviously not, but just to say that something about what you've said in terms of how the clinical work is an invitation to a kind of agency, maybe a radical agency, with a political or subjective, seems to be very, very significant.
Absolutely. No, I really appreciate what you're saying, because it's really, it's really solidifying and enhancing a lot of these points. To go back for a moment, like on the one hand, I think there's a kind of, sometimes a reflex among Lacanian colleagues to need to defend scansion and punctuating the session because it's, such a provocative thing for folks here in the States. I mean, Lacan's very clear that this can be an incredibly useful tool so long as it doesn't alienate the subject, right? So if your choices are what's going to maintain the treatment and continuing the treatment is sort of the primary goal here, then if you know that this is going to turn the treatment upside down, don't do it, right? As somebody who is trained relational, I'm not really a scansion guy, but I've done it with clients. We've had moments where for one reason or another, the session gets cut short. And afterwards, when we come back to the following session, we realize, oh, wow, that really forced me to say some things that I would have sort of run out the clock to not say, which is also a point that Lacan makes, that sometimes patients will run out the clock, right? So then I say to my patient, well, what would you say if periodically I sometimes end the session early and not necessarily communicate in advance when I'm going to do so? So we renegotiated the frame and we started doing scansion. And for this patient, it worked wonderfully, right? So even though I'm not a Lacanian, I don't really do this with most of my clients, but I can't not recognize the clinical utility, at least for certain clients. Now, of course, we can debate that back and forth, but I think it's important to underscore, right? There are so many modes of treatment, and by the evidence, by the research, most of them seem to bring something very useful to the table. but figuring out how to put it together in a framework that makes sense becomes incredibly important. To your broader point, though, this is an area where both for clinical and political reasons, clinicians often get very anxious, which is what role does politics play in the clinical work? The other anxiety, of course, has to do with, oh, are we doing something behavioral if we engage in these interventions? If we take Fanon at his word, that action upon reality is integrative, he not only, to my reading, meant this in terms of, say, a patient facing a phobia about riding the elevator, and so progressively exposing themselves to the anxiety until they're able to overcome it. It also means addressing the very real lived conditions in their lives politically that have an impact in their lived experience. So it's not only important sometimes to engage patients in behavioral activation or exposure in dealing with, say, their relational dynamics or problems in couples, therapy, or whatever. It's sometimes a real question when you're engaging with a client, say, who's talking about difficulties at work, and these are clearly difficulties at work that aren't just their own difficulties, they're things that people are experiencing because of their labor relationship within a capitalist system. And it sort of makes sense to me that as a process of analytic work, the patient may come to recognize, like, oh shit, like, it's not just me getting screwed, like everybody here is getting screwed. Maybe we need to do something about it together. Without any prompting from me, their lefty social democratic clinician, without any prompting from me, when they start acting in accord with their desire, they start doing political things. Therapeutically, it winds up making sense because they're engaging their world outside of the session and addressing things that may have otherwise been overwhelming because, my God, I'm just one person, what could I possibly do? But engaging them collectively in a way that restores a sense of agency, not just as individuals, but as members of communities, right? As members of folks who are sharing in some kind of suffering that's trans individual.
You know what it reminds me of is that section in Black Skin, White Masks when Fanon uses the phrase, which I might misremember, the dual action phrase, like we cannot as clinicians. So I had a few thoughts about that. One is presumably with some colleagues and some psychoanalytic practitioners who are always a little bit cautious about what they would see as a kind of appeal to the political, which might itself be a defense against psychical stuff.
Yes.
So, you know, there's that. And I'm interested to know how you might, you know, present that issue to such colleagues for whom that already sounds like a defensive move, the appeal to the societal, the cultural, the domain of politics, power, so on and so forth. But I'm also just wanted to make a comment in that section in Fanon, which is funny because you can imagine people reading it and going, you know, oh no, this is too political. A clinician's job is not to point someone in that direction. Right, but right. He's actually very cautious in how he gives the you know, and it's the dream a client brings of a Black man, if I'm remembering, of turning white. And you know, at the same time, Fanon's clearly listening to it with a psychoanalytic ear, with a clinical, distinctively clinical ethics, as well as a political sensibility. So that example has always intrigued me, but there's no clear question in what I've just said. But I wondered if you had any further thoughts about that example, and also maybe another way of putting it is sometimes I've heard colleagues talk about, and I've also spoken about it actually, like a clinical ethics and a political ethics.
Yes.
And yeah.
No, absolutely. I think the distinction is sound so long as the distinction isn't used defensively. I always hear it cited when the anxiety becomes, you know, when something political is happening in psychotherapy. I never hear the distinction when the political is being elided in psychoanalytic treatment. So it's very particular about when that comes up. I want to start by saying that the decolonial psychoanalytic perspective, as I'm articulating it here, I'm certainly not the only one. I didn't come up with it. It's not original to me, but I'm just articulating it. It's not that everything is sociological and we need to sort of forego psychic life and psychic experience, quite the contrary. It's about embedding psychic experience within broader societal networks. For this reason, I was really taken by Fanon's discussion of the character Jean Venus in René Maran's novel, because it's a lovely example where Fanon is looking at this character, which he thinks is an insert for René Maran, his own lived experience, of a Black Martinican man who grew up an orphan, disconnected from his family, his community, goes off to serve in the French army, starts moving up within French society, and achieves a certain level of class positionality. And he's very embedded in Parisian culture, and all his friends are predominantly white French people. And he gets to this place where he falls in love with this woman, and he has this fear that he will be rejected because he's a Black man. He pursues consult from a close friend who says to him, no, just reach out to her, tell her how you feel, it's going to be fine. And then he says, and anyway, you're not really Black, you're more of a dark brown. And Fanon discusses the ways in which Jean Venus is sort of entrapped within two things. On the one hand, there is the sort of sociological reality of anti-Blackness in Parisian society. And that's true, that's a sociological fact. But Fanon also says there's a way in which Venus takes a psychic position in relation to that sociological fact. And that psychic position is inherently neurotic. It's one that betrays, he talks about abandonment neurosis, that Venus is essentially saying, if I were to be vulnerable with this woman and tell her how I feel, then she will invariably abandon me because I'm a Black man. Therefore, I'm going to avoid intimacy with this woman and therefore protect myself from abandonment. And Fanon's response isn't, oh yeah, that's what you should do in an anti-Black world. His response is, no, this is an attempt to avoid abandonment. You're not acting in accord with your desire within an anti-Black world, right? So within that formulation, you can both see, like, obviously there's racial injustice, obviously there are various ways that this can manifest in our relationships, but there's a way in which this person isn't allowing room to see what this relationship will be like. They're already deciding that it's not something that can work. Now, it may very well be true, but it's being done in a way that's defensive, that doesn't allow for the experience to play out. Fanon's position isn't that he should pursue this woman in this relationship, and it's not that he should avoid this woman in this relationship. It's to create a certain kind of space for the person to act in accordance with their desire, regardless of the broader systems of oppression. That there can be a room for reconnecting with one's own desiring capacity, often against the world, as opposed to submitting it in order to sort of find one's place within the world. That to me is a much more complicated story than it's all sociological, it's all societal, it's all political. We don't have to look at their own personal subjectivity, as opposed to, oh, this is all just their abandonment issues. We don't have to think about racism. We don't have to think about capitalism or any of these things.
Yeah, that's really informative. I don't actually have much else to ask, Daniel. I mean, the one question I thought I might just quickly note was, you've got a nice quote when you say, another aspect of Lacan's technique useful to a decolonial perspective is his emphasis on the therapist's not knowing stance.
Yeah.
Any further thoughts on that?
Yeah, absolutely. I mean, let me think of what angle to come at this from. There are tensions both broadly within what's called cultural competence and broadly within the sort of relational, object relational, attachment-based clinical world that can run awry when it comes to a decolonial approach. Within the cultural competence scene, there can sometimes be this emphasis on, you have to like read all the book chapters, read all the articles, go to all the workshops on working with X population. And then once you achieve cultural competence, which can also be a sense of cultural mastery, like you now have control over your knowledge of the other subjectivity, that then you'll be better able to work with LGBTQ people, people of color, women, poor people, etc. And what the research shows is that that can actually be incredibly destructive, because then people feel like they're being put into boxes as opposed to being allowed to articulate their own experience on their own terms, which may include culture, race, and all these things, but in a way that comes from them, not coming from the clinician. That in part is what's led to the rise of cultural humility as a not knowing stance. Within the kind of relational, object relational world, there can be this emphasis on empathy, where empathy can often become understanding the other in terms of my own experience, feelings, what have you. And that too has a broad array of critique, both within the Lacanian world. Bruce Fink wrote this wonderful paper against understanding, but also the broader decolonial world, right? And critical theory broadly. Like I think of Saidiya Hartman's critique of empathy in Scenes of Subjection, right? There's a little bit of nuance there if you dig into the broader mentalization research, in that mentalization involves at least two things. I'm being a little reductive here, but for the sake of explication, I'm gonna do it. Two things. One is understanding others in terms of mental states, but the other is understanding that those mental states are opaque. You don't know in advance, and you can't possibly know in advance what it is that's actually going on for the other, but that you maintain a stance of curiosity, of not knowing, as Alessandro Talia, who's a attachment mentalization researcher, stipulates. And in seeing those connections, like, oh, wait a minute, well, I think Lacan offers a very important, almost decolonial corrective against understanding, where understanding becomes an attempt to box the other in within your own imaginary maps, right? Now, for me, coming from a relational framework, I don't think empathy is de facto bad. Empathy can be very useful, but I also think that it's more important to create room for opacity, right? So I can make that argument through an attachment lens, I can make that argument through a Lacanian lens, and that's where they, for me, start to come together. That in order to understand people, not just interpersonally, but across lines of difference, there has to be room for opacity and otherness in the way that people like Edouard Glissant talk about, and then that ultimately is more conducive to an analytic process than just trying to understand everything, right? And this is a point I often get into with my own students, like don't rush so much to thinking and feeling you understand what they're saying. Allow there to be some room for maybe you don't quite get it. Get them talking more. Like it's often more important to get the patient to articulate themselves than it is to say, than it is to punctuate every sentence with, oh yeah, that makes sense. Oh yeah, I understand. Oh yeah, that makes sense to me. Like that's often not as useful as people think, right? So it's not only an important clinical pragmatics, but it has decolonial potential precisely for this reason, that you allow something, again, surprising, something disruptive to come out of the patient's speech that shocks both of you out of the assumption that you understand.
Why Lacan atop a mango tree?
Oh, that's the title of the chapter. I mean, for me, personally, mango trees have a lot of resonance. Like I grew up in San Juan, Puerto Rico, under a massive mango tree that provided, a lot of shade for our family, and we would often, pick the mango. So there's a lot of personal memories attached to that for me. It's a place of home. It's, of course, a very kind of Caribbean, Latin American thing, right? So when I read Betty Milan's memoirs and telling of her analysis with Lacan, and she shared with him a dream where she imagined him in Brazil with her. This was during a period where she had broken off the analysis for a time. And while she had separated from him, like in her dreams, she kept thinking about him. And one of the things that she dreamt was that he was atop a mango tree, distributing fruits from the tree to everybody and singing a kind of, classical children's song. And I felt like there was something about her transference that was kind of, I use this phrase a lot, of baptizing psychoanalysis in the rivers of our experience. So yeah, it just kind of clicked for me, like, oh, well, let's let's dream about psychoanalysis atop a mango tree. Let's take that dream and see in that dream a heritage, an inheritance that we need to take hold of. Certainly all of us, but especially those of us from the global South. That's the reason I entitled it that way.
Well, thank you, Daniel. I think that's a wonderful way to end this interview. And thanks again for your time. And it's been wonderful to talk with you about a book which I think will be not only groundbreaking, but the reference text in years to come when people are questioning what it might mean to effectively decolonialize psychoanalysis.
No, I incredibly appreciate those words, and I appreciate the opportunity to share with you today.